Good morning, good evening, and welcome everyone to another captivating episode of our GS1 Healthcare Provider webinar series. Today, we embark on an exploration of the transformative potential of digital health in addressing some of the most pressing challenges in healthcare. My name is Mónica Soler, and I'm honored to be your host for today. Before moving to the presentation, I would like to briefly remind you on the GS1 competition law caution, under which all GS1 meetings are operated. So remember that the purpose of the group is to enhance the ability of all industry members to compete more efficiently. This means there shall be no discussion of prices, allocation of customers' products, boycotts, refusals to deals, or market share. If any participant believes the group is drifting toward impermissible discussion, the topic shall be tabled until the opinion of a council can be obtained. The full caution is available via the link below in case you would like to read it in full. So today we will examine a compelling case study of a large and very complex national health system to illustrate how the alignment of global standards, how innovation and a strategic vision facilitates connected care on a global scale. What do we mean by connected care? Connected care is where health information is not only available and accessible, but also perfectly integrated across the entire healthcare ecosystem. And this is essential to improve the quality of care in a digital connected healthcare system. At the heart of connected care are global standards, such as the GS1 standards, which play a critical and pivotal role in ensuring interoperability and efficiency within the healthcare patient-centric delivery. So without further delay, we are honored to have today with us our guest speaker, Mr. Ryan Mavin. Ryan is branch manager, Connected Health, Australian Digital Health Agency. So welcome, Ryan, to this webinar series today, and thank you for joining us, and the floor is yours.
Thank you, Monica. Just share the screen. Can I confirm that the screen is shared?
Yes, it is, Marvin. Thank you.
Fantastic, thank you. All right, and thank you very much for the kind introduction. So I am the branch manager for Connected Care within the Australian Digital Health Agency. And for a limited time, I am also the agency's architecture branch manager as well, which is a great crossover for today's topic as we delve into standards and connected care. I have been an advocate for standards and standardization across technology platforms to enable interoperability for many years. And healthcare is really the focus of my career for the last 13 years. During those 13 years, I have experienced success in extending and implementing standards that address clinical risk at the point of care. And I am now working at the Commonwealth level to focus my work on the sharing of health information across care teams, regardless of jurisdictional boundaries. So that's just a little bit about me, and we'll launch in. Now, before I begin, I would like to acknowledge the traditional custodians of the land from which I am joining. I'd like to pay my respects to their elders, past, present, and acknowledge and extend that respect to other Aboriginal or Torres Strait Islander people or elders from other communities who may be joining us today. I am joining from Canberra, Australia, which is on the lands of the Ngunnawal people. If you happen to be dialing in from other parts of Australia, you may wish to acknowledge the traditional custodians from where you're joining, and please feel free to write the name of the country in the chat. Now, onto the role of the Australian Digital Health Agency. The Australian Digital Health Agency, or the agency as I'll refer to it, is the national body that is jointly funded by the Commonwealth and the states and territory governments to deliver key national digital health infrastructure and a range of products and services. As the stewards of the national digital health infrastructure, the agency has a lead role in coordinating national engagement, delivery and adoption of digital health to enable a person-centric connected healthcare as guided by the National Digital Health Strategy, and we'll touch on that more later. The purpose of the agency is better healthcare for all Australians enabled by connected, safe, secure, and easy to use digital health services and technologies. The Australian Digital Health Agency is a national body called a corporate Commonwealth entity that operates under an intergovernmental agreement on digital health. And that agreement has been signed off by all Australian governments to accelerate the adoption and use of digital health services and technologies across the Australian health ecosystem as set out under our overarching legislation, which is the Public Governance, Performance and Accountability uh, establishing the Australian Digital Health Agency rule of 2016, and that's under some broader legislation that gives us purpose, which we generally refer to as the agency rule. But point being, there's some legislation behind what we're doing. Under the agency rule, the agency is charged with developing digital health strategy at the national level for Australia. This essentially gives the agency a mandate to deliver cross-jurisdictional priorities as set out in the intergovernmental agreement, as agreed with the states and territories. And that buy-in is really critical to our effectiveness in this space. Along with our partners, the agency is responsible for leading and coordinating implementation of the strategy and maintaining a national view of progress. The agency is also responsible for some key elements of the strategy, including the continued expansion of the My Health Record, which is the Australian national solution that supports consumer-controlled sharing of patient information with care providers, and other platforms underpinning secure and safe use of digital health systems across the nation. Our vision is for a healthier future for Australians through connected healthcare. And to realise that vision, we do this through influencing national policy, typically working hand in hand with the Australian Department of Health and Aged Care, that we refer to as the department, in collaboration with peak consumer organisations and other peak bodies. We transform care through interoperability and improved access for all consumers, which is very much where the standards become a key enabler, and prioritising investment in connected care systems and digital health capability. Partnering with consumers is very much at the centre of what we do, and it's visually represented in the centre of this picture here as well. Much of the complexity that is present in our solutions is really built around ensuring that consumers have control over their health information. And we certainly hold co-design as a core tenet, and that covers both policy and solutions. That's really critical to our success and identifies challenges like carers managing health information on behalf of their dependents and other things like accessibility options for visually impaired people on our user interfaces. So there's a whole range of areas where that collaboration is invaluable to us. Researchers certainly deserve a special call out here. Historically, we've seen research run on aggregated health information collated for billing or legislative reporting requirements. And as we standardize the ways of sharing information and how we describe that information, we move into an exciting space where data is more real time and that research moves into the primary use of data space, which is much a more immediate benefit to the consumers and the patients. The national infrastructure solutions that the agency is delivering aim to provide, or really to remove barriers to increase uptake. And I am personally a big believer that removing barriers creates space for innovation. Many of the vendors in the healthcare space have an international client base, and building solutions around standards, ideally international standards, means we are all speaking the same language, at least at the information and technology layers, and creating space where connected care can evolve. We have three digital health priorities that I'll drill into, and the first of those being to drive information sharing. This is really what needs to happen to build a critical mass of health information available to patients and care teams to maximize the value. And when I talk about that value, I'm not only talking about maximizing the value of the investment in the national infrastructure, but also maximizing the value to the healthcare provider that is taking time out to find details about the patient that's sitting in front of them, and also maximizing the value to the patient that uses the My Health Record to manage their own unique and complex health journey. Now, how do we do this? That's where the other two priorities come in. So priority number 2 is to improve connectivity and advance real-time data exchange. And this is where we, as the agency, take the role of stewards for health information and the standards that define it. This really kicks in at that point in time. We recognise that ensuring information definitions and methods of sharing it are consistent is critical to our success. Standards provide an independent and objective way to move forward. It's not just about picking up and adopting the standards. We know that if we build the national infrastructure and systems on these standards, the viability of those standards becomes a potential risk to the health system at large. So the agency's role as a steward encompasses the need to be engaged with the ongoing maintenance and governance of the standards at both the national and international level where appropriate. Lastly, priority number 3 is modernisation and modernising the national infrastructure. This is not just about refreshing old hardware and software and addressing technical debt. It's about re-architecting the solutions around standards. Health information is much more complicated than other domains, such as finance, where I've had previous experience driving interoperability. And the solutions need to be built around native support for health information structures and standards, and be able to leverage the global communities that extend these standards to support ever-increasing clinical, administrative, and research use cases. Bringing all this together, health information can be collected from a vastly expanded number of sources, including a patient's own information about their health or metrics gathered from wearables and more. Now, as we move on to look at what the national infrastructure is and what it supports, the foundations of a connected health system exist in Australia already in the form of standardised terminologies, unique health identifiers, national health services directories, clinical information system standards, and the My Health record, which is really at the heart of that at the moment. These products and services are built on a range of standards that enable them to function. And as we expand the standards, building support for new use cases, we leverage our investment in key building blocks while both increasing our breadth of health information available and unlocking innovative new use cases and new products and services to support them. The health identifiers, or HIs, as we refer to them, the HI service was one of the first building blocks put in place, and it creates the ability to uniquely identify patients, providers, and provider organisations. Being able to unambiguously identify the people associated with the information that we share across the system is a fundamental requirement. Other services, such as the National Clinical Terminology Service, provide the ability to translate between terminology sets that define coded elements of health records. Having services that can perform this translation is essentially a game changer in terms of the point of care solutions being able to capture coded clinical information in terms that they understand, and that information being able to be universally understood as the patient moves between providers in their care team, and that information is aggregated to draw both primary and secondary insights from. Now, we did at the introduction talk a little bit about the complex healthcare ecosystem, and Australia's healthcare system is no exception to that. Healthcare environments are typically complicated, and Australia certainly fits that profile. The complexity of the health system is reflected in the network of information flows through the ecosystem, and is reflected further and complicated by the federated nature of our states and territories, their own local legislation and privacy rules, and even further federated and distributed collection and storage of health information systems in various silos. What is important to recognise from this view, though, is that the needs of the system are wide and varied, and that both policy and technology enabled by the standards need to work in harmony in order for the best outcomes for patients to be achieved. The agency's relationship with the Department of Health and Aged Care and our combined relationships with the states and territories enables the coming together of both policy and technology priorities, and the fact that the part of the agency's funding comes from the intergovernmental agreement where the states and territories contribute means that we quite literally have many of our influential stakeholders invested in the outcomes that we need to jointly achieve. Moving on to Australia's digital health ecosystem and building on the system complexity we just talked about, we can see here a snapshot of the organisations we actively work with to identify target outcomes, the information needed to achieve those outcomes, the standards that define the structure and content of that information, and the standards that define how we move that information between areas of the healthcare system without losing meaning or clinical significance. We recognise the need for international alignment by default, and only extending the standards in collaboration with the local affiliates when we identify areas of the Australian health system that their needs can't be met by the standards as they are defined at the global consensus level. Coming back to the agency's role as stewards for standards, however, we recognise the role the Australian government needs to play in ensuring standards are both fit for purpose and sustainable. And while the specifics of how we engage with each standard development organisation is very much a case by case, we certainly find that they are all passionate about their specific areas of coverage and their unique value proposition. The objective always remains the same. We need to ensure that we have standards that will continue to support the Australian digital health ecosystem into the future. I did mention the National Digital Health Strategy at the start. So everything I've talked about so far comes together within the Australian National Digital Health Strategy for 2023 to 2028 and is supported by a delivery roadmap. The agency launched this in February this year, so it is still relatively hot off the press, and we're excited about where we're going with this. The strategy and the roadmap set out the priorities and the actions that will steer us towards a future where all Australians can access their own health information wherever and whenever they choose. These documents really are a product of national engagement and a collaborative effort by all stakeholders, and their release follows many intensive months of research, consultation, and collaboration, which is really a core value of the agency. They were developed through extensive consultation by the agency on behalf of the Commonwealth, the states and territory governments, and in collaboration with consumers, carers, communities, healthcare providers, industry technology vendors, academia, and other researchers. We also consulted with Aboriginal and Torres Strait Islander organisations, culturally and linguistically diverse communities, mental health advocacy organisations, and many other representative organisations. So we really needed to cast the net wide to ensure that we would be addressing the digital health needs of the entire health ecosystem. This inclusive approach has ensured that the strategy benefits from the collective expertise of all participants, and the perspectives of our many partners has been incorporated to create a comprehensive roadmap for digital health transformation. The strategy presents a shared view of the future and aims to deliver an inclusive, sustainable, and healthier future for all Australians through a connected and digitally enabled health system. It has a focus on system interoperability and the seamless exchange of information regardless of care setting, discipline, or jurisdiction. It provides direction to inform technology innovation, identifies opportunities for digital health to support national reform, and looks to address health system challenges. It does this by firstly identifying 4 change enablers, areas that we identified through the consultation in which consistent and ongoing effort is required so that digital health transformation can occur effectively and on a national scale. It then lays out 4 key system outcomes we wish to see achieved across Australia, being digitally enabled health and wellbeing services that are connected, safe, secure, and sustainable, a person-centered approach in which Australians are empowered to look after their own health and well-being, equipped with the right information and tools, inclusive and equitable access to health services when and where people need them, and data-driven decision-making at the individual, community, and national levels, contributing to a sustainable health system. The strategy is accompanied by a delivery roadmap, and this sets out clear and measurable steps for how the strategy will be implemented. Progressing the strategy is premised on a strong, collaborative, and innovative health and well-being ecosystem, and the roadmap is intended to focus this collective effort. It does this by setting out key priority areas listed on the right of the screen at the moment that require coordinated effort and shared investment over the life of the strategy. These areas facilitate achieving the strategy's 4 health system outcomes. It also includes key policy and behavioural changes that require leadership from governments to deliver health and system reforms on a system-wide level. It is worth noting as well too that our approach is to take this as a living document that will be reviewed and updated during the life of the strategy to keep pace with technology developments and emerging policy priorities as the health system changes and as we identify new challenges. Underpinning the current version of the document, there are 80 initiatives covered in the roadmap, each with an identified lead and the partners that we need to collaborate with. So we really have a tangible way of tracking this going forward to achieve that connected, interoperable target state. By listing these initiatives in the roadmap, we aim to guide stakeholders on areas where they can contribute to achieving the health system outcomes, and certainly tapping into the standards community is a key portion of that as well. And just a little bit of a plug for how we've set this up as well too. For ease of use, we've also added some interactive search functions for the National Digital Health Strategy webpage. So it's easy for people to find which initiatives on the roadmap and the action plan are relevant to them and where they can add some value into the process of transforming the digital health ecosystem in Australia. Now, given the topic of this talk is connected care, we can start to delve into defining what connected care is. And we often use the term interoperability in healthcare. And like many similar agencies, we have a set of principles that help to focus our efforts in order to achieve this goal. Taking this a step further, though, the collection of data through digital means has a purpose, and the ability to share and reuse it in an interoperable way also has purpose, and that is to create connected care environment for patients and consumers. So really bringing it all together in that space. The questions we really need to ask are: what is connected care? Why is it important? What are the challenges inhibiting connected care today? What is the impact on the health system? And what is the impact on consumers? The idea of connected care really focuses on the individuals who are involved in the health ecosystem, supporting those who deliver care by reducing rework and duplication and giving them access to the information that they need in a way that they understand. But just as importantly, it also means that the patient or consumer or their carers also has access to the information they need and can understand. Connecting the system and sharing the data makes the ecosystem stronger. As we continue talking through the role that the standards play in this vision, I encourage you to keep in mind that the consumer or the patient truly does live at the center of what we are trying to deliver. One of the elements to make connected care a reality is the adoption of common languages and the means of sharing data. The reality that healthcare faces in Australia, and is also true for other parts of the world, is that our race to digitize and adopt the latest technologies, or through that process, we've often created silos or conflicting ways of solving the problems we face. As part of the agency work or the program of work that we're embarking on, uh, that is enabling connected care, we lead a national digital health standards program of work that is focused on breaking down the data silos and enabling interoperability. We do this by ensuring that the data we are creating and curating has consistent approaches, and that we can share it and use it in meaningful ways. The digital health standards have really become a critical part of bringing the vision of connected care to life. Now, for many of us, when we talk about interoperability or digital health standards, we immediately think of a particular standard or standards development organization. We are on a GS1 webinar today, so perhaps they are the first thing you think of, or the first organization you think of. Our work with our stakeholder community and our experience in leading digital health programs has made it clear that as an industry, we have to take a holistic view and ensure that we are catering to all the relevant standards to help us identify, codify, share and use data effectively across the different technology and care environments. The Digital Health Standards program we have created is leading the work towards the adoption of standards as a foundational piece of our healthcare system. We are doing this by first identifying those that are relevant and then providing tools to assist in their implementation. We're also working closely with standards development organisations in the development of new standards where we have found gaps in what is available. Now, part of making this possible relies on building strong relationships with standards development organisations, both locally and internationally. And as this graphic shows, there is a lot of SDOs we need to consider when we are looking at the entire system we are trying to connect. Going into detail of the role that each of these play is probably something we don't really have time for today, sadly, but I would like to talk to you about a few of the organisations that are key to the connected care agenda. And on this note too, I do appreciate the challenges of developing and evolving standards that are fit for purpose to solve real world problems. What we really want to get across is that all of the standards are pieces of the puzzle, and we need everyone at the table, or the big picture just won't come together. The agency is taking our role stewarding standards very seriously, and there is room at the table for all of us. So firstly, SNOMED. The first of the standards that are a critical element to our program is SNOMED, formerly known as the International Health Terminology Standards Development Organisation. SNOMED rolls off the tongue a lot better. As you can see from this slide, SNOMED creates and provides terminology standards that underpin clinical documentation and reporting. And these terminology standards enable interoperability, precision and granularity, clinical decision support, quality measurement and reporting, and the foundations for large-scale analysis and research for population health, disease patterns, and treatment outcome measures. The role of SNOMED in enabling connected care is how it ensures that data can be codified and in any system in a consistent way, and can therefore be reused and interpreted consistently across the whole of the care journey. One of the agency's roles is to act as the national release coordinator for SNOMED CT, that's clinical terminology, as part of the national clinical terminology services we provide. And we have membership to the General Assembly and member forum, which happen to be underway this week. Australia has also developed a local extension enabling the generic management of medicines in a clinical setting, which links to the GS1 standards for product identification, the Global Trade Item Number, or GTIN, to support the linkage of physical products to clinical activities, which is quite a key enabler. Now, moving on to HL7, one of the most important of the standards within this complex space as we look to enable connected care at scale in Australia is FHIR, which is managed by the Standards Development Organisation HL7. Australia is focused on the accelerated adoption of FHIR as a key enabler of the connected care program. The acronym for Fast Healthcare Interoperability Resources, FHIR, is built around the concept of resources. Fundamentally, the aim is to build a base set of resources that either by themselves or when combined, satisfy the majority of common use cases for clinical care and the health ecosystem. FHIR resources aim to define the information contents and the structure for core information sets that are shared by most implementations. It will often reference other standards such as terminologies for SNOMED, identifiers from GS1, or observations from LOINC that help to define the information. FHIR delivers faster application development and interoperability, plus boosts information sharing in healthcare, especially on mobile platforms, through its flexible and scalable approach to problem solving, and interchange of data. The speed of development and ability to scale implementation by defining and building a base set of resources allows information to be shared by many systems and processes. It leverages other standards such as SNOMED terminology and the GS1 identifiers within its reference sets to ensure that it shares the data that is interoperable and reusable. One of the main ways it supports connected care is the ability to quickly and flexibly get more data into the hands of those who need it, the consumers, their carers, and the clinicians. What this means in reality within the Australian context is that adopting FHIR will progressively evolve use case by use case and incrementally increase the connection of care information. And this should then, page by page, reduce and remove paper records from the folders that patients with chronic conditions drag along to their medical appointments still today, because we haven't quite achieved our digital future state. Moving on to IHE. So integrating the health enterprise, or IHE, is all about interoperability. Systems developed in accordance with IHE standards communicate with one another better and are easier to implement and enable care providers to use information more effectively. Although one of the lesser known standards organisations perhaps, IHE really become critical when we are looking to not only implement the standards, but implement them in a standardised way. The value of these standards really do lie in their being informed by clinicians and the fact that they can be used to enable conformance testing, which is a key function that the agency provides as well. IHE value to connected care comes from their standards being focused on digitally enabled optimal care by ensuring that systems can talk to each other. This is a direct result of participation of clinicians in the standards development process, and these standards are solving problems defined by clinicians. So it really is grounded in that community. IHE standards help to eliminate the need for patients to repeat activities that slow down care or create unnecessary stress. The agencies work with both IHE Australia and IHE International to explore options for more holistic connected care. Includes conformance as a system assurance tool to underpin the capabilities that we're trying to deliver. Moving on to Standards Australia, another one of the big ones. So organisations such as Standards Australia develop standards to support local needs. They support many industry sectors, including healthcare, and more specifically support healthcare across a wide number of areas, including health informatics. Their long list of standards include technical specifications and other publications that support local practices. Where relevant, these may include adoption on international standards developed within the International Organization for Standardization, or the ISO, or other global standards development organizations or entities. Although less focused specifically on healthcare, they have multiple committees of experts that help to define standards that will support us in the digitally connected future of healthcare. And by enabling Australia to participate in global standards development under ISO, they ensure that our needs are reflected on a global standards level, such as the International Patient Summary, which over time will really become one of the key pillars of global connected care. So talking about breaking down those jurisdictional boundaries, that's breaking down the initial international boundaries. GS1. So GS1 is often overlooked in the world of digital health as it is better known for its supply chain standards. And I'm guessing that's no surprise to the participants here on this call. Most known for identification of products, other identification standards include those for locations, patients, care providers, documents, and assets. The power of its simple identification of data capture standards are used every day to help ensure important things such as the medication that we use is safe, that we can use terminology or technology to verify patients' identity, that we can verify who and where care took place, and that we can record medical implants accurately in a patient record to ensure long-term safety in the event of a product recall. As one of the semantic set of data standards, they support quality clinical processes such as positive patient identification, in addition to wider sector initiatives where they enable traceability. Amongst their new standards in development, we are excited about the standards that will enable demographic data to be added to the patient identifier. These will be especially relevant during transitions of care and in those scenarios where we are still yet to achieve that full digital enablement that we're seeking, or may not be as connected as we had hoped. So being able to pull that demographic information from a physical identifier or barcode data matrix on the patient rather than having to look it up in a system to address short-term needs. GS1 identifiers help remove ambiguity in clinical settings by ensuring data related to the healthcare activities, where they occur, and who or what was involved is uniquely identifiable within the clinical data that is captured in those events. They also put power into the hands of the consumers by enabling processes such as patients scanning medication to find information about the products. This helps to support more informed and complete care. And this is one of their key roles in enabling connected care. And even as we take a fresh look at the clinical supply chain, there remain opportunities for more of their standards to be used to digitally enable greater efficiencies, to return clinical time back to the care team through automation, to enable improved management and traceability of products, and to address areas such as sustainability and waste. And that's really the barcode's ability to support automated capture of identity information is really fundamental here. Talking about the way this is enabled. So as the agency continues to strive to enable connected care through our various programs that digitally enable patients and consumers, standards play an important role in making this possible. Within the My Health app that we have developed within the agency for use across Australia, for example, we're enabling access to increasing amounts of information from carers in a language that consumers can understand, as well as empower the individual to play a more active role in managing their care. All of this while capturing and accessing information that can help create a complete picture of both their health and their care. The foundations of this app are some of the standards that we have covered today, and adoption will continue even within our own innovation and products as we continue to lead the sector in digital health. Now, as we talk about what connected care is in practice, we start to think about every person is different in their journey. As a patient or a consumer of care, one of many reasons why connected care is so important. However, if we think about the average person, the standards we just talked about and others in the ecosystem play a critical role in making sure that the activities and the interactions can be captured, that the care processes are safe and focused on quality, and that during care, whether interventions are simple or complex, they can be recorded in a way that is consistent, enabling use and analysis. That the systems they are recording them in meet required levels of conformance, and that the complete data is able to be shared with the relevant clinicians, meaning that no duplicated tests or scans occur. There's no information missing. And that the person who is relying on all of these pieces of information working together gets the best care possible where they want it and can be better informed part of that care. In addition to the work that we do locally to ensure that connected care becomes a reality in Australia, through the use of global standards and by working with these standard organisations, there is also the possibility of greater global consistency, growing the possibilities of connected care on a global scale with standards such as the International Patient Summary. Some particularly exciting work that we can delve into there. But essentially, first, our goal is to continue to empower the people of Australia to holistically manage their care information, their healthcare journey, and ultimately their health outcomes. And putting the patient at the center of everything we do and using standards to ensure whoever provides care to the patient has all the right information in the right format to provide the right care no matter where that care is being delivered from. That's really the punch that we're trying to push ahead here. And that really concludes the key points of coverage I wanted to share with you regarding connected care and the standards. Happy to move on to questions.
Yes, thank you very much, Ryan, for this comprehensive and insightful presentation. It has been very enlightening for many of us, including myself, to better understand this complex word of digital health. And I echo your final words of the presentation. It sounds music to my ears, and I wish that we could do something similar as the project that you have run in Australia on a global scale, hopefully. So we now move to the Q&A session, and as we mentioned in the chat, we encourage each of you to take this opportunity to engage directly today with Ryan. This is a chance to delve deeper into the Connected project and gain valuable insights firsthand. So there are a couple of questions on the chat already. So let me go with the first one. How important is article master data for products in digital health infrastructure?
Thank you. Sorry, that was how important is
The master
article
data.
master
Yeah,
data?
yeah, it is.
I would certainly say fundamental. So as we work through the evolution of the standards that define that master data, it's critical that we have a common understanding of that information as it passes through different silos or organizations as part of the healthcare ecosystem. And having agreed terminology to describe the terms within that master data is fundamental also. So that really is a key culmination of all the standards we've talked through here coming together to enable that information sharing.
Thank you, Ryan. We know that master data alignment between healthcare systems or hospitals and providers is always a bit painful everywhere. So this is maybe the reason why this question is on the chat. So, and second
I
one,
might
what?
extend on that a little bit more before we go on to the next question as well too. So
Yeah, sure.
I did touch on the National Clinical Terminology Services. So where master data will have specific terminology references, if you mentioned the challenges with other areas of the health system needing to be able to understand that if a particular local system uses a terminology set that's not the one that's used at the master data level, the clinical terminology services can do that translation so that we have an ability to solve that problem rather than it being a barrier to implementing sharing of information.
Thank you, Ryan. So let's go to the next question. You mentioned GS1 helps link to physical and digital words and the role in enabling positive patient identification. Can you explain this a little further, please?
Certainly, certainly. So I did mention at the start that I've had some success specifically delivering or reducing clinical risk at the point of care. And one of the particular examples of this is using the GS1 standards for patient identification and provider identification to reduce the risk of wrong blood in tube at points of pathology collection. So having, as we move into a digital world, it's very easy to get abstracted from the physical world, to think about the data, the connections between systems, etc. But having that anchoring, and I used to refer to this as technology control points, where we can use something like a GS1 data matrix with a patient identifier in it as something that has to be scanned physically to link a care provider to a patient at a particular point in time in care delivery. Now, in the case of the wrong blood in tube example, that meant that we could eliminate the risk of multiple collections being done and then labeling happening after the fact, which is where the clinical risk of mislabeling specimens came in. By forcing a scan of a wristband for a particular patient identifier that had a GS1 identifier in it at the point of collecting, and then also scanning the specimen ID, which was a GS1 identifier also, we're able to ensure that the clinician doesn't move on to more collections before they've completed the process properly in the systems and labeled the products appropriately. So that's one example. Certainly moving into the medication space is another one as well too, as we deal with physical medications. Being able to scan that medication and scan the patient for closed loop medication management means that we've got that full traceability and uh, opens the door for automated data capture as well.
Thank you, Ryan. The idea of connected care is really exciting. And how else can the GS1 standard support this?
Look, I think certainly being part of the conversations that the agency is facilitating. So we are keen to work with GS1 and all other standards development organisations to appropriately identify use cases and work collaboratively where, well, ideally to leverage the standards as they exist today, but where the use cases are pushing the boundaries, work together with the people who are using the standards to extend them as appropriate. I know there's been examples of that in the past where we have looked at the patient identifiers being modified in collaboration with GS1 to better support broader use cases. I guarantee as soon as we achieve what we currently think our digitally enabled future state is, there will be a myriad of new use cases that we haven't thought of. And having all of the standards organizations working hand in hand with us to tackle those problems as they arise on an interoperability enabled foundation means that we should be able to respond quickly to those needs as they arise rather than taking a more waterfall, slower process that we typically see with the current ecosystem.
Awesome. So you mentioned several times, and I also mentioned in the introduction that connected care sounds really complex, and after the presentation is even more complex, even though we have some light after your presentation. How have you determined which standards should be used? Because we have seen a lot of them in your presentation.
Sure, sure. So I guess in the Australian context, we're lucky enough to have a really engaged community that drive these decisions. And the community is made up of technology developers, clinical people which understand digital health, which is a fantastic combination and a rare combination, the implementation of technology as well, and they also operate clinical practices. So these are really quite skilled individuals. We have comprehensive consumer representative engagement that ensures that decisions are really well informed as well too. So it's through this community that we share the knowledge that have really informed the decisions around which standards need to be included. And there are already some great examples of where the power of this knowledge of this community can help define the future of what's best in terms of patients and consumers. With more to come, there's certainly a lot that we'll need to tap into this, and the agency is certainly trying to foster that community and the collaboration between standards development organisations rather than siloed individual engagement with each standards development organisation.
We have a question on the chat says, I'm assuming local care provider and patient identifier is associated with a national unique identifier. When and how is that registered and rostered?
Certainly. So yes, within Australia, we have national identifiers for patients and providers and their provider organisations. We refer to them as the IHI, the Individual Healthcare Identifier for patients, the HPII, Health Provider Identifier for an individual, and the HPIO, the Health Provider Identifier for an organisation. It's the combination of these that allows us to uniquely identify a patient, a provider, and the context within that provider is giving care. That's managed centrally by several government agencies at the moment. The intersection of that with the GS1 standards is interesting too, because within the hospitals and within the care settings, local EMRs implement the GS1 standards for patient identifiers. The national identifiers that we use are quite long, not particularly human readable. Not that a GS1 key is meant to necessarily be particularly human readable, much better than our identifiers though, but it's not built for sticking into a GS1 data matrix and doing the automated identification data capture processes. So what I've seen in practice is the GS1 identifiers being used on wristbands and GS1 identifiers being used on staff identification cards within the healthcare settings. And we map to those national identifiers when we are transferring information between jurisdictions, between care settings, etc. I appreciate that is a duplication that we have in Australia because of the timing of when particular identification keys were being selected. And I do understand that in other nationalities and different healthcare settings, that is one and the same identifier, which is fantastic. Just a complexity that we have here that maybe is not a problem for everyone on this call.
Thank you for the answer. Going back to the standards, you talk about the standards all working together. Can you elaborate on how this works? Do they all compete with each other, or how does this work? Could you put some light on this?
Certainly, sure. So I guess the great part about the standards in healthcare and the standards development organisations is that they actually do work together. And a lot of the stakeholders that are part of those processes are already working across multiple standards as well too. We've got clearly passionate people who understand the depth of this information that work across multiple areas. This is especially true at a global level as well too. I see a lot of the same faces in the sessions that I go to for multiple different standards organisations. They do certainly complement each other. And for example, while the GS1 identifiers are really describing the physical products, there is a linkage to SNOMED terminology for medicine. So we can link the GTIN for a particular pharmaceutical product to the coding of that product that would be showing up in a clinical information system or an electronic medical record. And beyond that as well too, for low-ink codes for terminology and observation vocabularies. Taking a holistic view and looking at all of the standards is actually one of the most important aspects of delivering connected care. And I certainly see, while there is certainly passion and people protecting what they do with their own standards development organizations, there is a real genuine drive, and I find this across healthcare in general, not just in the standard space, that the common link of driving the best outcomes for the consumers and enabling consumers to control their own care journey and outcomes is a unifying factor across all of the standards development organizations. So I appreciate where those standards development organizations are much broader than just healthcare. that becomes a more targeted piece. But there's always something common for us to anchor our passion and drive against, and I certainly see that in healthcare every day.
Okay, thank you. There is another question on the chat. It's a bit long, that one. Let me ask you, do you have in Australia some hospital needs for some trends that can be formulated in upcoming tenders beyond regulations? Knowing that TGA is promoting to accept GS1 standards like unit dose for the 5 rights of medication administration, personalized therapies, tracking of biological examples from Australian to international hospital for more genetic exams, etc. So the question is, do you have in Australia some hospital needs or some trends that can be formulated in upcoming tenders beyond regulations?
Uh, Look, it's certain that we do, and we, as government agencies, we do advertise where procurements are coming up. So if there's any vendors in the space that are looking to respond, that would be what to look out for. Uh, what we are trying to do as we drive the interoperability agenda is create a minimum set of clinical information system standards that will be broadcast out. It will be optional for jurisdictions and healthcare providers to use those, but the idea is that we provide them to help them procure solutions that will, by design, interoperate with the rest of the healthcare system, rather than procuring solutions that have extremely expensive and prohibitive uh, journeys to go through before they can share information appropriately. So I guess my answer is we are trying to help the system as a whole understand what they need to do to be able to interoperate, to be able to share information, to be able to draw insights out of that information. And we are open through that collaboration process that we've talked about to gather information and gather those requirements and ensure that they are holistically looking at what the technology future of the landscape looks like to shape the products that end up emerging into that landscape.
Awesome, perfect. Going back again to the standards, um, how do you foresee GS1 standards evolving to meet the changing needs of the digital health landscape? That's a
Look, it's already happening, so I could probably refer to the Sparked program, which is being driven by a collaborative with the Department of Health and Aged Care in Australia and the Australian Digital Health Agency, along with the CSIRO and HL7 Australia. This is an initiative that's really looking use case by use case at priorities for information sharing and building out implementation guides that will deliver on those particular use cases as we progress. Now, this is the start of that journey. We are starting to define the core information sets that will enable some of those initial use cases. It's a drop in the ocean. We know that we will need to continue to progress on and to focus the passionate standards communities on the high value use cases as they arise. I would love to be able to say that we can mobilize thousands of people to start pumping all of these standards specifications out in parallel and deliver digital health much sooner. But the reality is we have a journey to go through in terms of upskilling the industry as well. And that does relate to another point I'd like to share in terms of what the Australian Digital Health Agency is doing in partnership with our Department of Health in Australia. We are sponsoring and making available training in the HL7 standards, and we're looking to make this a more broader, holistic standards for the health sector type approach, so that there are more skilled people within the industry who understand the standards, understand the role that they play in enabling interoperability, and are able to actively contribute to that community going forward. So we're looking at a systemic uplift of capability for both organizations and individuals, and removing the cost barriers for doing so.
Thank you. This is a very good advice indeed. So, and talking about advice, let me ask you. There are no more questions on the chat, so let me ask you maybe a final questions to wrap up a little bit. What advice would you give to other healthcare organizations that are looking to implement a similar connected care complex project?
Certainly. Look, I would certainly start with collaboration is key. Needing to consult and work with various standards development organizations, peak bodies, consumer groups, and whoever else is a stakeholder within your particular healthcare setting. Pardon me. This is we can't force interoperability onto a health system. We need to bring the health system on the journey with us, and it is certainly a collaborative effort. Be realistic around the timeframes and the costs that may be involved, and try to, I guess, think and plan strategically, but act tactically. Take steps where possible to remove barriers to innovation. I think the way I have typically done this in the past, and the GS1 identifies as a key example here. In my previous experience in the healthcare sector, before we even had use cases for positive patient identification, we were implementing the GS1 identifiers for patients and providers. And even though there was nothing to scan them, they were there ready to scan when we had use cases ready to go forward. We knew that the identifiers were already there on products. We started placing GS1 location identifiers around the hospital. So if we needed to pick up a location specific to a care event where a provider and a patient have interacted, that information was there available too. So taking those tactical steps wherever possible based on international best practice and international standards means that when the problems do arise, there are fewer barriers to doing those innovative changes quickly.
Absolutely. Those are very good advice for our attendees today. So thank you very much once again, Ryan, for your exceptional contribution to today's webinar. We truly appreciate the time and effort you have invested in sharing your knowledge, your experience, your advices with all of us together. And I think it has given us a deeper understanding of the importance of the interoperability and standardization in the healthcare systems. I would also like to mention our colleague Kath Coates, your expertise and dedication, both during your time at GS1 Australia and now as part of the agency, has been instrumental in connecting all the dots. And finally, we would also like to thank our colleagues at GS1 Australia for their support in disseminating this webinar to the local community. Thank you all for being here today with us. One last thing, registration will be open shortly for the next webinar, an award-winning case study from NHS Scotland. So please stay tuned. Thank you, goodbye, and take care.